is Dr. Joseph Kafuma here at Women's Hospital International and Fertility Center, Bukoto. Today I'm going to talk to you about IVF, IVF treatment or test tube baby. I know you might have heard a lot of names to mean this treatment known as IVF. Yeah, but IVF has been in Uganda since 2004. It started here at Women's Hospital International and Fertility Center. By the way, in Eastern Central Africa, IVF started here in Women's Hospital. But what exactly is IVF? IVF, the other name is test tube baby. But IVF, each letter stands for something. IVF means in vitro fertilization. In vitro fertilization. So IVF is a form of treatment which we use to treat couples who have failed to conceive due to one reason or the other. Yeah, but IVF, basically, in such couples, a pregnancy has failed, conception has failed. Because we know for conception to take place, there has to be a sperm and an egg. But for a sperm and an egg to meet in a woman's body, a number of factors have to come into play, which do not necessarily based on the sperm or the egg. So there are other, factors to do with the fallopian tubes, to do with the uterus, to do with the cervix, to do with the sperm numbers. So all those factors have to come into play. So where we have short in any of those factors, then a pregnancy might fail or conception might fail. We use IVF, as I've said, in couples where conception has failed, we have people who have been trying for so long, 20 years, 5 years, 10 years. A pregnancy has failed. Then there are also other special cases where you find a couple is able to conceive, but then maybe they want to change the sex of the children they are getting. Maybe they've had like 5 consecutive pregnancies which have resulted into only girls, and they want to get a boy. So they don't want to leave it to chance. So they come to us, and then we do IVF. Then some other cases, such as couples whereby the lady and the husband are both carriers of sickle cell. Such couples, if they don't want to have sickle cell diseased children, so they can also come to us and we do IVF. So IVF, just as I've said, conception has failed to take place in a woman's body. So what we do, we get the sperm, we get the eggs, and then help them to meet outside the body in a test tube. That's why it's called a test tube baby. So this is a test tube. It's a glass tube. In vitro means glass, in a glass, So we aid the sperm and the eggs to meet in a tube. This is where we put them. So we put the eggs and the sperm in here, in the laboratory. After we've extracted the man, we give him a container. He puts his sperm in there. Then for the woman, we stimulate her ovaries to mature as many eggs as possible. Then once the eggs are matured, we extract them from the body. Then we get the eggs and the sperm. We put them in a tube, a glass tube like this, a test tube. So after we put them together, we put them in an incubator. At times we use a dish. This is a dish, a glass dish like this. So we put the sperm and the eggs in here, then put them in an incubator. An incubator does the purpose of, how the body would have handled the sperm and the egg to meet in a woman's body to fertilize. So the incubator performs that function. So after we put the sperms and the eggs in here, we put them in an incubator. Then the process goes on as it would happen in a woman's body. So in short, IVF, we aid the sperm and the eggs to meet, but outside the body, in a glass tube or in a dish in the laboratory. So after the sperms have fertilized the eggs, we get embryos, of which we get like 3 and then transfer them back into a woman's womb for implantation and pregnancy to happen. So basically, we get the eggs, we get the sperm, put them together in a dish in the laboratory. We get babies, then those babies or embryos, we put them into a woman's womb and then pregnancy goes on. So that's IVF. Some of the things I've been talking about, IVF, fibroids and infertility, herbal medicine and treating infertility. The answers, many of the answers can be found in these books that I'm holding. These books were written by Dr. Edward Tamale-Sali, who is a renowned fertility doctor with over 40 years of experience. So he has put his experience in writing and he has come up with these books. So there is one which is known as Male Infertility Made Easy with an African experience. So everything you need to know about male infertility, the causes, treatment, you know, where to go for help, can be found in this book, Male Infertility Made Easy. Then there is another book known as Female Infertility Made Easy with an African Experience. So things to do with I've talked about IVF, I've talked about fallopian tubes, fibroids. All that information can be found in this book, also written by Dr. Edward Tamale-Sali. So these books are available at Women's Hospital. So you can feel free to ask for one when you come to the hospital. Yeah, so many of your answers will be answered through these books. I know that, I'm sure. Yeah, so get one. There are also so many other books that are available. About sex selection, we have spiritual books also, all written by Dr. Edward Tamale-Sali. Yeah, so, yeah, be blessed.
Health Links, all your health needs in one place.